All right. Thank you very much. So it's great to be here. And what I want to do today is talk about an area where I think research hasn't informed what we do in health policy enough. And that's the effect of providing facts and information to people. One of the things that I've studied in my research is how difficult it is to change people's minds about controversial issues. And this is an area where the experimental research, I think, provides very different results from what your intuitions might be, and I think highlights the importance of research that really tests those assumptions and validates them empirically. So the problem that I'm interested in is why people believe things that aren't true about the world, either things that are definitively false or that are unsupported by the best available evidence. So here on the left, we have the now infamous Affordable Care Act myth of death panels, and on the right, the false claim that vaccines are poisoning our children, right? And in both of these cases, we have very widespread misinformation despite clear and overwhelming evidence to the contrary. Right? So the question is, why is this and what can we do about it? Right? And so the typical instinct is to say, well, people don't have the right information, we need to give it to them. Right? And I think that's probably the instinct of most of the people in this room, including myself, right? And that's an appealing way to think about the world. I wish the world worked this way. I love to live in this world. I don't think we really do. This is sometimes called the deficit model in science communication. And it's the idea that if people don't have information, we simply need to provide to them and they'll update their beliefs and attitudes. And that's unfortunately not how the world tends to work, as I'll talk about, but it's the implicit model, not just in health and healthcare, but in education and journalism as well. Now, the problem is when we give people information, at least about controversial issues or issues that implicate aspects of their identity, the response that we get doesn't look like this, but it looks more like this, okay? And this kind of reaction is what psychologists call disconfirmation bias. And it's the idea that people tend to be unduly skeptical of information that contradicts their existing beliefs and attitudes. And of course, it's important to make clear that applies to all of us as human beings, including everybody in this room and including myself. Okay, this is a fundamental aspect of how we process information, but it's one that can have very surprising results and results that suggest that some of the interventions that we undertake in providing information to people may actually be ineffective or potentially even counterproductive. So let me show you some evidence of that, first from my field of political science and then in the domain of health. So in both of these areas, there have been significant efforts undertaken to try to correct widespread myths. So on the left here, we have an article from PolitiFact, which is one of many prominent fact checkers in political journalism these days. And on the right, a facts and myths brochure from the CDC. That's a common approach in health communication to list myths about a given health condition or behavior and then provide some factual information contradicting those myths. But are these approaches effective? That's the question I'm interested in. Okay, so starting first in the realm of politics, this is Colin Powell testifying about the supposed threat of weapons of mass destruction from Iraq before the US invasion. As we found out in the official US report here on the right, there actually were no weapons of mass destruction or active weapons of mass destruction programs. And yet the misperception that Iraq had weapons of mass destruction persisted for years after the war, right? Despite massive, overwhelming evidence to the contrary that was very widely circulated. Right? So what my co-author and I wanted to investigate is, well, what would happen if the media had been more aggressive in fact-checking the claims that were still being made after the war, suggesting Iraq had these weapons, okay? And so we experimentally manipulated a mock news article to show people corrective information, telling them that, in fact, the official report of the US government had said that there were no weapons of mass destruction or weapons of mass destruction program, okay? And what we found was that among liberals who were pretty unlikely to believe in this myth in the first place, the correction was quite effective. So relative to a control condition where people didn't see that corrective information, belief in the misperception went down, but it was already quite low. Now, among conservatives, which are the group we'd expect to be predisposed to believe in this myth, given the political circumstances, we see the opposite reaction. When they were provided with the corrective information, belief in the myth approximately doubled. And this is what we call the backfire effect, and we think it's driven by this disconfirmation bias. People counter-arguing information that contradicts their existing attitudes or beliefs or challenges someone that they feel positively toward. And we found similar results looking at beliefs about death panels in the Affordable Care Act. So let's turn now to health. There are similar concerns about misinformation, specifically in the area of vaccines, which is, of course, an important issue in public health. Most infamously, the Wakefield article alleging falsely that there was a link between the MMR vaccine and autism. Okay, that was published in 1998. And The Lancet subsequently retracted and discredited. The author's been stripped of his medical license, but this myth continues to echo in the debate over vaccines. Right? And so, again, the question is, this misinformation is widespread. What do we do about it? Well, first of all, how widespread is it? More than half of parents in the U.S. say that they're worried about serious adverse effects of vaccines. And a quarter of parents agree or strongly agree that some vaccines cause autism in healthy children. So these misperceptions are very widespread. So again, the question is, what do we do about it? Is corrective information the right way to promote vaccines? If parents are hesitant about vaccines, should we be challenging them and saying, no, vaccines don't cause autism? That claim is false, right? Well, that's, of course, the instinct that most folks have, including our friends at the CDC. And this is the information that's on their website. I don't expect you to read it now, but basically what it does is it lists a series of studies refuting the vaccine autism myth. Right? So this is very much that idea that people don't have the information and we need to give it to them. Right? Here's the evidence. We're going to throw studies at you and see if that changes your mind. So again, my co-authors and I were interested in how effective this was as an approach to promoting vaccination. Okay? And so what we did is we tested the effects of seeing this information relative to a control group in a nationally representative survey of parents with kids at home under age 18. Okay? And I have good news and bad news to report. Okay? The good news is that belief in the myth did go down. Okay? So what you can see here is the predicted probability that respondents in our survey would strongly agree that some vaccines cause autism. And you can see that relative to the control condition on the left, the corrective information, which is highlighted in red there are some other conditions I'm not going to talk about in the interest of time. That control, relative to the control condition, that correction moved belief in the myth downward, right? So it's having the intended response. Fewer parents are expressing agreement with the myth that vaccines cause autism, okay? And yet, and you knew there was the bad news coming, when we asked them, how likely would you be to vaccinate a future child with the MMR vaccine, which is the behavioral outcome we're most interested in when it comes to vaccines, we found the opposite result. Okay? We found a negative effect. Parents were less likely to say they would vaccinate a future child rather than more when we gave them that corrective information. So the question is why? And when we looked more closely at the data, we found this effect was concentrated among the parents who had the least favorable attitudes towards vaccines. Okay? And that's who we're zooming in on here. This is approximately the third of US adults with kids at home who have children at home under age 18. And what you can see is there's a very significant negative effect of more than 20 percentage points on their stated intention to vaccinate a future child. Okay? And we think, again, that's driven by that response of counter-arguing. They may say, okay, fine, vaccines don't cause autism, but what about these other concerns I have? What about these other hesitations and questions? And in the process of bringing those to mind, may end up feeling less favorably towards vaccines rather than more. So in the time I have left, I just want to highlight some areas where research can inform practice in health policy based on this kind of research about how to communicate most effectively about controversial issues. Okay? The first point is reinforcing myths is very dangerous. And this myth-busting approach, however appealing and intuitive, runs the risk of entrenching these myths more deeply or generating the kinds of responses I've highlighted. This is a facts and myths brochure from the CDC about tobacco. So I have very similar concerns about this. It may also be more effective to think about which sources might be more credible in addressing people's concerns, especially parents' concerns. So when it comes to vaccines, parents overwhelmingly say their child's doctor is their most trusted source of information, not government agencies or scientists, right? So someone who has a personal relationship of trust may be a more effective advocate. Similarly, when it comes to healthcare reform, people who oppose the Affordable Care Act are much more credible in saying there are no death panels than someone who supports it, right? So we should think carefully about who might be the most effective advocate in communicating the sort of information instead of just assuming that facts alone will do the trick. So the bottom line is we need to think carefully about the messages we use instead of just throwing science and facts at people. That's rarely an effective approach, but we can only find that out if we test the messages we use. Thanks.